Everybody, and welcome to today's demonstration of the PEPID knowledge base. What I'm going to be showing you today is PEPID's standalone web browser application. So this is an interface that an individual doctor or clinician could subscribe to get access to the information that PEPID has in the knowledge base. But it's just for demonstration purposes where any piece of what you see today, content, tools, etc., the data can be modularized and integrated with whatever your existing platform or solution is. This browser version just makes an easy platform for us to demonstrate with. I was going to give a little bit of background about PEPID just to start off. PEPID's actually been around for over 25 years and started originally as a point-of-care reference tool for doctors and nurses. And we've kept the same ethos throughout that time of trying to make our information as readily accessible and actionable as possible. So everything about the way that our information is curated, organized, and presented is designed to help clinicians who have a lot of demands placed on their time and attention get the most information and the most relevant information as quickly as possible so that they can make a medical decision and get through their workflow faster. That's ultimately our mission here. So again, like I said, we are been around for 25 years. We have successful integrations with all of the big EHR platforms, Epic, Cerner, InterSystems, MedHost, etc. And we've been used by the White House Medical Unit for the last 3 administrations running. So it's a very powerful knowledge base, and I'm excited to show it off a little bit. So again, this interface, the web interface, is just for demonstration purposes as related to the integration of the knowledge base, but I wanted to familiarize you with the layout just a little bit before we progress. So along the top here is where you'll see we have a search bar, of course. So you can search for any topic, drug information, disease information, etc. using the search bar. And then just below that, we have all of these tabs that show all of the different sections and clinical decision support tools that are available in the knowledge base. So here it starts with favorites and notes. Again, in this web interface, I can add specific topics as either personal favorites or add notes if I want to, append my own thoughts to the content. The content tab brings us to this home screen where we have, you'll notice, a 2-panel layout. So we have a right-hand panel, which is where all of the content is going to be displayed. Right now, you can see I've got kind of a table of contents area showing all of the different sections of information that we have included in here. Then on the left-hand panel is going to be used for navigation and for our tools, which you'll see as we progress further. Right now, it's just showing a blank favorite section. Continuing along the top bar here with our tabs, we have our drug interactions tool, which is our most powerful and most popular integrated module. Everybody needs to check for drug interactions, so it's obviously very important. We have a drug allergy checker as well. A library of medical calculators. We have many hundreds of calculators for everything from calculating BMI, body surface area, nutrition scores, depression screenings, equianalgesic dosing, narcotic equivalents. Anything that you could think of is in the medical calculators. We also have a differential diagnosis tool, a lab manual with reference ranges for popular tests and labs. We have a pill identifier that allows you to find pictures and link to information about drugs that can be identified by their by descriptions, color scoring, imprint, that kind of data. We also have a news and alert section in here. This allows our editorial team to highlight different topics that are either in the news currently or maybe have been recently updated or that we want to draw attention to. And then under the More tab, we have even more tools. So we have an ICD lookup tool. Obviously, we have all ICD-10 codes included in the database. We have an indications tool that allows us to search for drugs by indication or vice versa, finding where a medication is indicated for a specific disease or not. And we have an IV compatibility tool. This data is based on Tressel's IV compatibility, and so obviously has a lot of applications there, including compatibility with solutions. Lastly, we have a dictionary here. This is just a table of contents with definitions for all of the terms that appear in the database. So let's go ahead and start by looking for a clinical topic. So I'm going to search for a disease using our search bar. I'm going to search for pelvic inflammatory disease so that you can see what some of the information in the database looks like. And like we talked about, I have a right panel and a left panel here. So the right-hand panel is where our content is going to show. So you can see this is what a monograph for pelvic inflammatory disease will look like in PEPID. One of the things that you'll notice is that all of our information is written in bullet points. So we pride ourselves on being comprehensive, but we also always want to be concise. Again, there's a lot of medical information that's available to clinicians, and so we want to make sure that we're organizing our content in a way that is high yield and allows a clinician to make a medical decision more rapidly when they're viewing the information. So we're very strict about how we organize all that info. The left-hand panel is where we have what we call our quick links. So if I don't want to be scrolling through the monograph on the right-hand side, I can click on a subheader or a section in the left-hand side. Say I want to look at diagnostics. I can click on the diagnostics quick link, and then my monograph will jump to that section. So now I'm looking at my diagnostics section. Another thing that you'll notice as you look through PEPID content is that we have a lot of blue hyperlinks layered throughout. These can link to either other topics within the knowledge base or to clinical tools. In this instance, we have a link to view an image next to this ultrasound. So if I click there, then now I have an ultrasound here. We have an entire library of medical images, many thousands of ultrasounds, x-rays, CAT scans, etc., for help either with diagnosis or for instructional purposes. Thousands of illustrations as well that are proprietary to PEPID, plus a video library that has instructional material and procedures. That's also the truth with the written content as well. It's not just diseases and drug information. It also includes procedures and guidelines that are regularly updated as well. Another link that I want to highlight down here towards the bottom is we have a library of bedside education handouts. If I click on this link in the browser interface, then it will open up a downloadable PDF. But obviously all of this information is available in the knowledge base as well to be integrated with your platform. This is all written in a patient-facing voice, and it's full color with illustrations like I talked about. So patient education information is obviously really important as well. So this can be integrated with your EHR or other solution. So let's say that I am reading about this disease and I want to find a treatment option for a patient. I can click on the treatment quick link here. And then you'll see that all of our drugs that are listed within the monograph are also hyperlinked. So like I was saying, we have all of the disease content. PEPID also includes a full proprietary drug database. So I'm going to click on a drug and you can see what some of our drug data looks like. So I'm looking at gentamicin. So this is a drug that has the monograph on the right-hand side. Once again, quick links on the left-hand side. And you'll notice that towards the upper right hand here, we have a few different icons. The one that's highlighted right now is for our hazardous materials handling information. This is part of the USP 800 requirements for how to handle hazardous materials. PEPID has this information as well, so obviously that's available. Then we also have the option to add notes, either institutional notes or individual notes. Again, that's for the purposes of this web interface, but if you are a hospital or a clinic and you want to be able to add your own policies, guidelines around a medication, you can do that through this notes feature. plus the option to add a topic as a favorite. On the left-hand side, again, I've got my quick links to jump to any section that I want. I've got a patient education handout like we showed. If I want to look at adverse drug reactions, I can look at that, mechanism of action, indications, etc. And one other exciting thing is that, like I said, in addition to the links, the blue hyperlinks throughout the content going to images or linking to other topics, they also link to some of our clinical tools. So say I'm looking to do a dosing calculation for a pediatric patient. I have a pediatric dosing section right here. I've got all of my blue links for my different calculators, and I can click on any one of these. And in the left-hand panel, now you'll see that I have a dosing calculator. I can enter whatever the values are for my patient, hit calculate, and then now I've got my dosing calc done. So all of the dosing calculators are also available by API along with all of the drug data. And we have thousands, many thousands of dosing calculators. I think we're somewhere over 3,000 different dosing calculators plus an additional 1,200 pediatric dosing calculators, which is a big differentiator for us. That's more dosing calculators than any other provider on the market today. So now we've shown you a little bit about PEPID's clinical content, our drug content. We've highlighted one of our tools, dosing calculator. I also wanted to show our drug interactions checker, which I said is our most popular integrated module, so that you can see another one of our CDS tools here. If I click on that drug interactions tab, now you can see in my left-hand panel, I've got my drug interactions checker is open. I can be viewing this at the same time as I'm viewing clinical content on the right. So everything about the layout of this, we've been deliberate to try and make sure that you can navigate as easily and quickly between different pieces of information as possible. Let's go ahead and add in some medications here. So I'm going to look at fentanyl, let's say, is in the news a lot. So I'm going to add that to my selected drugs box down here. Again, this is just a browser interface. When integrated with your portal, you wouldn't have to manually enter the drugs. Always want to make sure to emphasize that. But let's go ahead and just keep adding a few more so that we can show you how it works. So I'm going to add in codeine. And you can already see I've got some interaction alerts populating down here. Let's add one more drug, verapamil. Again, we want to present as much information as quickly as possible. So my interaction alerts are already populating down here. You can see that they're color-coded by severity. I've got little triangles here going from 1 to 5. That's least to most severe, of course. I've got in the text even, we have little indicators PK and PD for pharmacokinetic or pharmacodynamic interactions. That's something that your pharmacist will like to see. And all of our interactions are done on the ingredient level. So I can include herbals, supplements, foods. I'm going to add St. John's wort, and you can see that my number of interactions is going to increase by quite a lot. Now I'm up to 13. I can also add lifestyle choices, things like smoking or marijuana. It's all in the data set, so you can check for interactions between any of these components. If you want to filter the alerts in order to prevent alert fatigue or to highlight what you want to focus on, I do have filters for level of concern. Let's look at just the interactions that are rated at a 4 or above, or I could filter by substance as well. So I've got my 4 remaining interaction alerts. These are the most serious interactions that I'm looking at. If I want to drill down into an interaction to get more information, I just click on the alert, and we have these quick descriptions of the interaction. This gives a high-level overview. If I want to do a deeper dive and drill down, I can click on more info. And then we have an interaction monograph. For every interaction that we have in the database, you can get these expanded interaction monographs. And these cover all of the information that you would want to see. Mechanism of interaction, including pharmacogenomic information. You can see that I have some enzymes here that are highlighted. I can read about the effect, level of concern, and then specific to PEPID, we also have this action section. The idea of the action section is to provide concise suggested next steps for a clinician, so that we are not just providing information about the interaction, but again, helping an actual clinical professional make a decision that's going to help them get through their workflow faster, and using fewer cognitive resources. So this action section is really powerful for that. Source of recommendation, of course, is included, for whether the interaction is predicted, recognized, both, and then all of our references are cited here at the bottom. So this is a good opportunity to talk about where the information in the knowledge base comes from. And so PEPID employs an in-house staff of medically licensed clinical professionals. That's physicians, nurses, pharmacists. Everybody consults the relevant evidence-based resources that you would expect, journals, textbooks, etc., in their area of practice. They curate that information and write it up in PEPID signature style with our bullet points, focusing on being actionable and high yield. Everything that we write goes through a process of internal peer review within our editorial staff, followed by a process of external peer review with our clinical partners. So all of our pharmacology information is reviewed by ASHP. All of our emergency medicine information is reviewed by ACEP, the American College of Emergency Physicians, etc. So you know that it's been validated and reviewed by empirical sources. So that gives just a brief overview of the PEPID knowledge base, some of this web interface that's available if you were looking for a standalone product. We have a mobile application as well. And again, just to reemphasize, every piece of what I've showed and what I haven't, whether that's clinical information, drug data, dosing calculators, interactions, drug allergies, interactions, pill identifier and imprint data, medical calculators, etc. All of this is available by API, can be modularized, and can help to elevate the offering that you're putting out there today. So thank you everyone for your time. I do appreciate it, and I hope that you have a great rest of your afternoon.